Now we are going to continue with the pathophysiology of sickle cell. Now for the pathophysiology is how sickle cell can result to its complication. Now we need to know that what the complication for sickle cell are divided into two. We are going to have acute complication and we have chronic complications. So those are the two major complication types. For the acute complication, the first part that we need to know that they are generally crisis for the acute complication. And for the chronic complication, we are going to have chronic complications that we are going to visualize in their different topics. Now, you need to know that what there are different crises. The first crisis, the major crisis that the patients are going to have is going to be vaso-occlusive crisis. Vaso-occlusive crisis. Vaso-occlusive crisis is the major presentation of sickle cell patient. Vaso-occlusive crisis. Now, the second one is the next one, which can be in the case of sequestration. You can have also sequestration crisis. You can have sequestration crisis. The third one, we can have aplastic anemia. Aplastic anemia. Aplastic anemia. The fourth one, we can have so we can have aplastic anemia, vaso-occlusive crisis, and the last one we are going to have hemolytic crisis. So those are the different elements that you have to visualize. Now, inside the vaso-occlusive crisis, you need to know that you are going to have things like hand-foot syndrome. You can have things like hand-foot syndrome, and we have things like acute chest syndrome that you're going to visualize there. Is it clear? So now let's explain what happened in vaso-occlusive crisis. In vaso-occlusive crisis, so you need to know that normally the red blood cells are going to be biconcave shape. Is it clear? Every time now that there is a period of a stress factor or the precipitating factor, when there is a stress factor or a precipitating factor, it becomes now sickle shape. And when it becomes sickle shape, the sickle cells now are the one that are going to occlude the blood vessels. And when they occlude, the major blood vessel that is usually occluded are the blood vessels at the levels of the joints, and so the blood vessels at the level of the joints, and bones. Now the question that you're going to ask me is, why is it that generally these blood vessels are the ones that are occluded? The blood vessels here are occluded because they usually have a small caliper. They have a small size. Generally, these blood vessels are usually having very small sizes. So when there is an increased viscosity of blood, the first person that are going to be suffering are generally the blood vessels of the joints and the bones. So that's why that's the first organ that usually presents with the crisis. That's vaso-occlusive crisis. I hope you're understanding. So that is the element that you have to bring out. So they have small caliper, you have occlusion, and that occlusion now results to the vaso-occlusive crisis. Now the vaso-occlusive crisis can constitute of just inflammation at the level of the joints. You can have inflammation at the level of the joints. So you have pains at the level of the joints. You have pains at the level of the joints. Now pains at the level of the hand. Now, so those are the different ones. Now the other ones, now when you have pains at the level of the joints, the hand, the feet, so that just generally the distal part of the body, since the distal part is going to still be less perfused than the proximal part. Now the next one after that, we have also what is called the hand-foot syndrome. Still in the vaso-occlusive crisis. Now for the hand-foot syndrome, what happens there? Here you are going to have inflammation of the hand. We have inflammation of the hand and the foot. The hand becomes swollen, the foot becomes swollen. The hand and the foot become swollen because of reduced perfusion, and the hand swelling is called dactylitis. The hand and the foot become swollen. The hand swelling is going to be called dactylitis. And this hand-foot syndrome is that swollen hand and the swollen feet. Though it may not, it is usually painful and may not be associated with other vaso-occlusive crises like joint pains. It is the first presentation of a patient. Is it clear? It's the first presentation of a patient. And when talking about the first presentation of patient, we need to know that what sickle cell patients, you start visualizing sickle cell disease as from 6 to 9 months. Is it clear? So we should never speak about sickle cell in patients who are less than this age, less than 6 to 9 months. Is it clear? That's the first presentation. These children that have sickle cell are not going to present with vaso-occlusive crisis or painful joints and all that. They are going to present with handful syndrome, that is swelling of the hands and the foot. Is it clear? That's generally their first presentation. Now the question is, why is it that patients that are less than 6 months do not present with sickle cell crisis or sickle cell disease? This is simply because when you are less than 6 months, you have what is called the fetal hemoglobin. Is it clear? You have the fetal hemoglobin. Now you need to know that what the sickle cell trait do not affect the fetal hemoglobin. The sickle cell trait do not affect the fetal hemoglobin. It instead affect the adult hemoglobin. Is it clear? It instead affect the adult hemoglobin. And now since children are less than 6 to 9 months, they still have fetal hemoglobin, all their cells are not going to become sickle cell shape because their hemoglobin is still normal. Is when the child is going to be more living in nature, that is, there is a conversion now of the fetal hemoglobin when it was in utero to the adult hemoglobin when it's out utero. Is when there's a conversion with a higher percentage of adult hemoglobin that now the child now is going to become now at the risk of having